Hello, I'm Aidan, I'm a paramedic. What's your name, sir?
Paul.
And what's your date of birth here?
22nd of April 1965.
And what do you call that here?
I've got a bit of a headache.
Got a bit of a headache?
Yeah, it started about 10 minutes ago.
Okay, so I'm just going to look at a general impression of the area and the patient himself. So just looking for any medications or mobility aids, which I don't see any. We'll look for signs of neglect or signs of substance abuse such as alcohol. I don't see any, so I guess we'll continue. So are you having any pain at the moment?
Oh, just the headache.
Just a headache. So what about any dizziness?
No dizziness.
What about any other funny feelings?
No funny feelings.
No funny feelings. And I'd just like to assess your nervous system, just to see if everything's okay. It's not going to hurt or anything.
Okay.
Is that fine?
Yeah, that's fine, yeah.
Cool. Just quickly, can you tell me what this is?
That's a pen.
What's this?
That's a torch.
And what about this?
That's a watch.
Okay, I'll just get you to quickly remember three things, and I'd like you to remember them, because I'm going to ask you about them later.
Okay.
So, computer,
Computer,
car,
car,
and table.
table. Computer, car, table.
Yeah. And do you know where you are at the moment?
Yeah, I'm at home in the lounge, yeah.
Okay. What day of the week is it today?
Today is Saturday, yep.
And what year is it?
2015.
Yeah, cool. Could you just say for me hippopotamus?
Hippopotamus.
And could you say the quick brown fox jumped over the lazy dog?
The quick brown fox jumped over the lazy dog.
So I'm not noting any slurred staccato speech, so he's pronouncing the syllables together, so he has no cerebellar dysfunction. I'm just going to shine this light in your eye. Is that fine?
It's fine.
Cool. Righty-ho. So the pupils are constricting. Both of them are, so the pupils are equally reactive to light. Could you just focus on this for a second? In, out, and just assess the cranial nerves by going to the various extremes of the visual field. I'm not noting any nystagmus either. Right. Can you see that for me?
No. Yes.
Right now?
Yep.
Okay, I'll just check the other side.
No.
Can you see that?
Yes.
You can see that?
Yeah, I can, yep.
Okay, I'd just like to get you to go out for me for a second. And could you puff out your cheeks? And could you shrug your shoulders? Okay. I'd like to just get you to close your eyes. I'm just going to touch you and I'd like you to tell me where I'm touching you. Okay?
Right foot. Left foot. Right knee. Left knee. That's my belly button. Right hand. Right elbow. Left hand. Left elbow. Left clavicle. Right clavicle.
Okay, you can open your eyes now. I'd just like to grab your hand, thank you, and I'd just like to move it, just relax there. Just taking it through its full range of motion, just make a note if there's any rigidity, which I'm not finding any at the moment. Okay. No rigidity in the leg. That's fine. And could you just put your arms out like that for me and close your eyes for a second. So I'm not noting any pronated drift. I'm just going to push down on one hand and I'd like you to try keep it level with the other one. Okay, so there's no rebounding. None there. You can open your eyes now. Right, could you just put your finger on your nose and then touch my finger and then do that again.
That's a bit tricky.
It is, but I need to do it. Okay, cool. Could you just squeeze my hands, squeeze my fingers, okay?
Yeah.
And could you push up on my hands, yeah? Push down, do the same thing, so yeah, push up, push down, so that's chest and the biceps and the triceps. And now I'd just like you to do a simple test, which is just have one hand out like that, and then put the other one like that, and then go like that. Right, now try it with the other one. Right. Yeah, so I'm looking for signs of dystokinesia, which there are none. I'd just like to quickly check your legs now. So if you just want to push your foot up against, yep, down, and then just lift your leg up, push your leg down, push your foot up, push your foot down, lift your leg up, down. I'd just like to test your reflex. I'm just going to you just below your knee. So if you just support your legs like that. Get my little hitting device.
Is that the tendon hammer there?
That is the tendon hammer there. Only hope. Okay, so that's good reflex there. It's not hyper or hypo-reflexive. Cool. And I'll just let you to stand up for a second. Cool, so I'm just noting his stance. He's seems to be standing well, with no broad-based stance, which is suggestive of a cerebellar dysfunction. You just walk to here and back, thanks. Okay, cool. And now, could you just walk heel to toe doing that? Yeah, just like that. Okay, and I'd just like you to quickly just try to maintain your balance with your eyes closed. So without the vision, we're testing the sensory ataxias. So this requires proprioception and the vestibular system to adequately maintain balance. Okay, you can open your eyes now, that's fine. So you can sit down if you like. So you're not having any other funny feelings? It's just a headache?
No.
Okay, so right now we've assessed our dermatomes, our myotomes, we've tested reflexes, we've tested his level of consciousness, and he's responding and alert, so he has a GCS of 15. He is has no memory abnormalities, so we've also done a fast test to check for stroke, and we've found no pathology there. If we did have any abnormality with the fast test, we would want to whisk him off to hospital because it could be suggestive of a stroke, but we have no cause for concern there. So this patient would be a low acuity patient for the neurological assessment, so I'm happy with that, and we'll move on to assessing the next system.